Hi, I'm Dr. Edgar Campos. As part of our knowledge videos or our training videos, we'd like to share some information with you. We talked about already the drain removal, one of the most frequent questions. But why we leave a drain is very important. If you understand why we leave a drain, you'll know why that part of the surgery is so important, and that little detail will help you to avoid any problems in the future. The drainage is basically a tube or a connection tube or some like a soft rubber tube. There's two kinds of drains. The open drains, like a Penrose drain that basically drains by itself, and the drains that they come with suction or vacuum, so they have a negative pressure. They're always aspirating liquids. We basically use open drain as a Penrose drain. One of the questions is, will my body react on the drain? Well, if you have any allergies or if your body reacts to any kind of material, we have silicone drainage and we have latex drainage, so we can cover both of the sides of the story. Leaving a soft drain is quite important. Hard drains normally can stimulate some tissues, and that could be a little bit more uncomfortable. Leaving a soft drain, normally it's a little bit more easier to handle after the surgery. For us, it's very important to leave a drain because in the past 4,000 surgeries, it works well for us. It works well because it's a window to the inside. The technique where to leave a drain is quite important. What we do with the Penrose drain is we make a little notches on the side. So your drain will be basically all the way around on your staple line. And it's quite important because if something happens with the staple line, like bleeding or like inflammatory fluid or any complication happen, we can spot it right away because the drain or the Penrose drain will be basically a window to the outside, so we'll be able to spot. You'll be basically evaluated every 4 or 6 hours, and we'll continuously be evaluating your drainage. So it's quite important for us to see how much of the fluid are you getting output, the quantity, the quality, how the fluid looks like, and that's so important for us. The drain is not meant to be forever, so during 3 days we can do further leak tests. When you have the barium swallow, we can spot the drain on the side of the stomach, and basically we can spot that nothing of the barium comes through the drainage. When you have the blue dye as well, you can spot that all the blue dye goes inside the stomach and nothing comes outside of the drainage, which is very important. So basically, the reason about leaving a drain, it's spotting any complications like bleeding or spotting any complications like leakage. So when you're covering those sites, basically the risk of having a complication and not being seen or not to think about it, it's much lower if you have a drain on your body. But if you have a drain on your body, you need to have a proper technique with the drain. If you put the drain very high and rubs the diaphragm, it's normal that you can have superficial breathing. It's normal that you can develop any pulmonary problems. That's why we put the drain and we locate it under the diaphragm without stimulating or rubbing that part of your stomach. So basically the drain will be on the side, but it will be like floating on the side of the staple line, not over the staple line, not over the diaphragm. That's why it's so important to have a drain in your body after the surgery.